health. This is a good one. One of the hardest parts about being a parent is to know how to deal with your kids when they get sick.
Yeah, it happens all the time. Send your kids off to school, they come home with some bug. It can be tough for doctors and for nurses, too. NBC News medical correspondent Dr. John Torres headed to Columbia University's School of Nursing to check out the new teaching tool, helping students understand what a child's symptoms are really trying to tell us.
Meet Hal. Hi, Hal. I'm Dr. John. How are you doing? Hal is one of the world's most sophisticated medical simulators, designed to look and act like a 5-year-old boy. From the student perspective, Hal's more than a computer.
Oh, absolutely. Hal's a patient.
Is that better? Just like a real child who isn't feeling well, Hal can blink, cry, and even talk. But it's the little robot's realistic way of being sick that teaches nurses and doctors how to communicate better
and blow out
with their pediatric patients.
Good job.
Kids can't always tell you what they're feeling.
Yeah, they can't, fully explain where it hurts, why it hurts. Our goal is ultimately to have that correct diagnosis.
In today's real-life scenario, Hal has come to the clinic with a bellyache. The students and I work to figure out what's causing it. The symptoms: bellyache, vomiting, fever, pain in the lower right abdomen. What could it be?
Many things.
Give me some examples.
Stomach virus.
Yeah, stomach virus.
So go over the 4 quadrants.
Ow.
For the most part. What's the big thing you're worried about the most? Appendicitis.
Yeah.
Diagnosis: appendicitis. This time, Dr. Kelly and I go behind the scenes to control Hal, who is showing signs of asthma. The symptoms: coughing, wheezing, shortness of breath.
I want you to take a little deep breath in through your nose and not too long to breathe out.
That makes me cough.
This is the superhero mask.
I don't think I like this.
And how are you feeling?
Are you feeling a little better? A little bit.
I don't know exactly what led up to it, but I'm thinking he has an asthma exasperation right now.
Diagnosis: asthma.
All right, scenario is done.
Okay.
Great job, students.
You really are doing a great job.
A lesson in better communication that almost literally comes to life. Has Hal ever sat up by himself?
No.
Okay.
If he doesn't, I'm gone.
Me too.
As a true laceration of the liver due to blunt force trauma, you can see all the fluid that's now surrounding the actual liver itself, all around the periphery of the actual liver itself. And as we have the patient breathe in and out, you can see the fluid collection. In this case, you have a true liver laceration. You have the actual laceration shown here on the superior pole of the actual mid-region of the liver itself, which is right in here. By identifying this, you can actually go to a sagittal view and show the actual radiologist or the doctor on staff that once again, you have liver laceration verified by the fluid all around the organ itself. You can increase and decrease your depth to visualize specific regions of the liver, and pulling out again if you want the whole frame to capture the liver itself.
Live, getting results with Bridget Ellison, Julie Broughton, and meteorologist Candace Campos. This is News 6 at 9.
My family says I'm one of the smartest kids around. I can show you how I feel by moving my face and my eyes. And if you talk to me, I'll talk back. Let me show you.
Okay, he's amazing. This is Pediatric Hal. He's one of the most simulated 5-year-olds in the world and is made right here in Florida.
This lifelike boy is also getting results for nurses, doctors, first responders with advanced medical training.
Joining us now, Jim Arquetto from Gaumard Scientific and the makers of these simulators. Welcome.
Thank you.
And you've brought along Pediatric Hal with us, as well as Super Tory. And so we were all saying during the commercial, we've got to focus. I mean, this is And so tell us a little bit about Pediatric Hal. I know he was talking to us, and he's reacting right now. I've never been on a 3-shot with a robot.
He is. And the reason he does that, and the reason you see how realistic these are, is because nurses and pediatricians and first responders need to get information from these patients.
Yeah.
And the problem is they're nonverbal most of the time. Certainly the baby's nonverbal. And 5-year-olds in a stressful situation can be nonverbal as well. So the first responders need to get information very quickly. And how can they do it? By facial expressions, by movement, by tears. So he can simulate pain, he can cry, and he can move his face, as you can see, how he's tracking towards us, because they need to get that information very quickly and non-verbally. So working with pediatricians, we were able to configure his face to respond just the way you see him responding to you now.
Yeah, and if we say his name, Hal. Hello? Oh, he's ignoring me. Well, I'm used to it.
It's okay, buddy.
That's
doing okay? Yeah, we're okay. It's okay.
Here you go.
And he does talk a little.
He does, yeah.
So
Where's Dad?
I'm
Oh,
right here,
well,
buddy.
there you go.
Where's Dad?
It's okay.
Dad's right there. I mean, and when you see us so excited about Hal, you seem so proud of the work you guys do.
Right.
What's that feeling now, seeing them actually come to life practically?
Right. It is amazing, and we always look at these as educational models, because what we're doing with these simulators is ensuring that the next generation of nurses, physicians, first responders are really prepared for those critical situations. And that's why we're so proud of this work, because we know that folks can train on these before they ever get to a real patient. So they can perform real medical procedures on these simulators using real equipment, a real EKG. If he has a heart attack here today, we can defibrillate him with a real AED that's out in your lobby.
What?
And bring him back.
Them even giving birth to them.
We do. That's right. Yes.
Explain that.
So we have an adult female, Victoria, who actually delivers a baby, and it's extremely realistic because, again, we look at these high-pressure situations where nurses and physicians really need to be very well trained before they get to a situation with a real patient. So that's why these are so important, and you're right. That's why we are so proud of them.
And the baby just twitched. And so, first off, how do they work? I mean, in the most layman terms for us.
Sure. Well, you can see that I have this tablet in front of me. So these are wireless and tetherless. They're only connected via radio frequency. And the reason for that is emergencies don't always happen in hospitals. They happen wherever. So we need to be able to control these simulators from this tablet remotely. So that's the first, is this wireless communication that we have. The second is the servo motors and the pneumatics and hydraulics that are inside. So as you described in the introduction, it is a robot. It's a medical robot. And inside, if we were to take these very realistic skins off, that's what you would see are these electromechanical components and the software and hardware that controls all of that. And you're right, we do develop all of that in Miami, Florida.
And so we have the American Academy of Pediatricians meeting this weekend here in Orlando, big conference for them.
Right.
How do these robots, play a role in that convention, and what's the next frontier? Because that's always what you see at these types of events.
So we are here today because of the American Academy of Pediatrics, and we work very closely with that organization. You can see how realistic these simulators are, and that's based on input for those from those pediatricians to ensure that they're getting the right training that they need. What's the next step? Well, technology continues to advance. So 5 years ago, even we couldn't have envisioned something like this because we look at not only the technology of making it small, but or firehouses or the simulators we make for the military on a battlefield. So they need to be reliable and working all the time. That technology just didn't exist a few years ago. So how is technology going to advance? Don't know. Smaller, faster, more reliable. I'd envision all of those things coming in the future.
And I mean, I'm sure the reaction of people when they first see these, even medical professionals, I mean, they just have to be blown away by this.
Yeah, it's stunning. Yeah, especially folks who may have been in practice for several years, and they may have trained on an old CPR dummy, as it used to be called.
Annie, are you okay?
Right, right. And now they see something this realistic and engage, just as you've been engaging with him this morning. Because that scenario, we want to ensure that the learners are engaged with their patient and gaining that connection with their patient. And we can do that with him, and the learners can as well.
You can even make him cry.
Sure.
Well, we don't want to do that.
I don't want to make him cry. No, don't make him cry.
Right.
You've heard him speak, so.
He can even bleed, so.
We don't want to do that either. We have a rule, no bleeding on the set.
No bleeding, no crying.
Julie's in love.
Clean that up.
Well, thank you so much for being
Our
here.
pleasure. Our
Thank you
pleasure.
for bringing them.
You're welcome.
They were
Yes.
such great,
Such well-behaved children.
They are
I know,
well
the
behaved.
best children we've had in here in a while, including my own.